Hello and welcome to the Dr. Duncan Show. I'm your host Maria, and this special segment is going to be Q&A with Dr. Duncan. We're going to be addressing questions that viewers like you are sending in. Different patients of his have asked him questions over the years, so in this section he's going to be answering those questions. So if you have questions you want him to answer, feel free to go to our website. It's www.chiropracticworks4u.com. And over there, go find the link to our email and send in your question, and your question may air on the next show. Our phone number too for you is 248-398-1650. I'll give you that number again, 248-398-1650. Thank you. Welcome to the Dr. Duncan Show. We're continuing our Q&A series, and I want you to really remember that feel free to send in your questions. If you send in your questions, and remember I gave you the website, but I will give it to you again, it's www.chiropracticworks4u.com. And our phone number, 248-398-1650. If you send in your questions, you may get to hear your question answered right here on Q&A with Dr. Duncan. Welcome, Dr. Duncan.
Oh, welcome. Thank you.
Great. It's great to have him here to answer the questions directly. You're getting answers from a trained chiropractor, everyone. So I'm your host as usual, Maria, and today we're going to be continuing our discussion on chiropractic. We have discovered that everybody can get chiropractic treatment from a chiropractor. But my question is, Dr. Duncan, I know a lot of people now have insurance. Do they have to get a referral from their primary care physician, from some MD, before they can come and see you as a chiropractor? Do they need to contact the insurance carrier? What is the procedure? How does a patient get to come in?
Oh, very
to
simple.
Your office?
Very simple. Just for the audience information, I want you to know that chiropractors, as a general, we are considered as primary care physicians.
Wow.
Now, I'm going to define what that means in simple. That means actually anybody over 18 years old can walk to my office, and I have the ability and I'm trained to make sure that I monitor what's going on. If there are pains, I can diagnose what's going on. If they need to be referred to another physician, I have that ability to be able, I'm trained to do that. If they don't need a referral to be seen by another physician, I have the ability to start taking care of them from my office. So just to answer your question, simple, you do not need a referral from your general practitioner, your MD, to come to see me. All you have to do is call the office and we should be able to get you in. The only way, and I'm going to make sure this is very clear, the only way you need a referral to come to see me is if you have what you call managed care. And that means basically you have an HMO plan. And an HMO plan means that you cannot see anybody. Even if you wanted to see another doctor for whatever condition, you always have to have your MD give you a referral. And that is very distinct. But that's only for people with HMO plans. Anybody who does not have HMO plan, I'm talking about people with Blue Cross Blue Shield, I'm talking about people with Medicare, I'm talking about people with United Healthcare, I'm talking about even people actually who have been involved in an accident and they don't even have insurance. We will be able to treat them and we will be able to build their auto carrier. And so I want to make sure you understand that this is how great and how powerful it is to be a chiropractor and to be able to help you get yourself back.
Very interesting, very interesting. So now you've heard, you do not need to go through anybody. You can call us directly, or even better, why don't you stop by Dr. Duncan's office? You know, we are located on the corner of 9 Mile and Coolidge Highway in Oak Park, Michigan. I'm going to give you the address, so you want to grab a pen and paper so that you can be ready, because I will be giving it to you through the show. Now, the actual address is 23120 Coolidge Highway. That's in Oak Park, Michigan, and the zip is 48237. I'll give it to you one more time. I know you're grabbing that pen. So here you go. It's 23120 Coolidge Highway in Oak Park, Michigan, 48237. So swing on by and come and see him for yourself. You don't need a middleman, not unless you have that managed care. Now, Dr. Duncan, I do have another question that one of your patients was interested in finding out. Because some people maybe were in an auto accident or had some kind of condition, and their MD referred them to physical therapy. So they're currently being treated by a physical therapist, and they have confusion about whether they can do that and also come to you as a chiropractor. Can you address this question, please, for us?
Very, very important question here, and actually very important in the sense of the fact that I am trained and I have passed the boards of being a physiotherapist. So I understand especially what a physical therapy does, and I'm also a licensed chiropractor. So I have both worlds in my understanding, in my knowledge. And so I want to make sure I make this very clear to our audience that what the physical therapy does and what the chiropractor does is totally different. In the sense that a chiropractor is trained to align the spine. A physical therapist is not trained to align the spine. And that's why an adjustment, especially when you have been involved in an accident, there is no way you can really recover without an alignment, especially when you have come involved in an auto accident. And the reason is because biomechanically, your bones are shifted out of place by the trauma of the accident. And so just having physical therapy has to be added to chiropractic to make the cycle complete for your healing. And also, just for those who are there listening and they are wondering how, I have a pain management doctor and he's giving me, pain medication for that. I am not against that. I want to let you know that we all have to work as a team to make sure that our patients get better and get better the right way. And that is so important. So you can definitely come. If you are doing physical therapy, we will examine you and we will focus on what we are trained to do, and that is adjustment, alignment of your spine, which is going to determine the future of your health. So call us.
I kind of like what I'm hearing. I don't know if you got that from him, but it's like chiropractic is more of holistic healthcare. Because if you heard him, he is not against pain management doctors, and he has an understanding of what physical therapists do. And he also understands that you may be in a situation where you had to receive care from your medical doctor. So I think it's great to have this whole holistic approach where the different fields of medicine and physical therapy, and the different branches of pain management can all come together. And because in the long run it's for my benefit, it's for your benefit if you have this whole resource of trained doctors working for you and working on you. You're in the best condition to be receiving healing, total healing, whatever your condition is. So I really am appreciative of that answer. And so for those of you who are seeking care, keep going where you're going, but feel free to stop by and see us, because like he said, chiropractic adds that extra dimension to your care, which hand in hand with your medical doctor and whatever other specialty you're seeing will really work towards bringing you total healing. So thanks again, Dr. Duncan, for that. I have one last question from a patient, because he has told us that anybody can be a patient. Chiropractic is not geared towards the elderly or the very young. It's geared towards people of all ages. You don't have to have a middleman to come and see Dr. Duncan. You can come and see him unless you have managed healthcare where you will need a referral. So with all this background you've given us, some people may be wondering, okay, I'm coming to see you, I have my insurance in order, or I presume you take patients who are cash, who don't have insurance, but they might want to know, how long do I have to keep seeing a chiropractor before I see results? Is it a one-time visit, or do I have to come multiple times in order to get really the full benefit of care? Because, you know, especially in relation to a medical doctor or physical therapist, there are differences in how you go for care. So how is chiropractic different? Tell us about that.
Oh, very, very important. And I get to hear this all the time, because some people say, well, if I see a chiropractor, do I have to see the chiropractor the rest of my life? Now, I'm going to give you answers, very simple. Now, when it comes to chiropractic care, remember, number one, we are not giving you medication, or we are not shooting you any chemicals in your body. And so, it's all natural healing. Now, there are very important things that we always tell my patient, that there are three major dynamics of care. And the first dynamic of care involves what we call the intensive care. And the intensive care is all based on actually relieving the symptoms. Very simple. Getting the symptoms, meaning we get the pain out of the way. That's number one. The second part of care is what we call corrective care. Now, in the corrective care, actually somebody might not really have physical pain or having symptoms. But that care is geared towards correcting the problem that caused the pain. And then we have the third part of the dynamics of care, which we call the maintenance care. The maintenance care is kind of like a tune-up of a car. Sometimes you use your car for so many miles, and then you want, to take to a mechanic to tune it up so that the engine is running well, the oil is all together. And that becomes very important part of care, which is maintenance care. And maintenance care can mean, hey, you just woke up with a little tightness in the neck, and you just come, boom, one adjustment gets you back to the road. And so, all I'm trying to say is it has dynamics, and the dynamics are simple. Three important types of care: the intensive, the corrective, and maintenance. And so whenever we see patients, we tell them they have the choice to choose whether they want only the symptom care, which is basically the initial intensive care, which get the pain away, or they want more corrective, or they want also the maintenance care. Very, very important.
Wow, very interesting. So I know you're like me, you're really like, wow, this is a lot of information, good information. So we want to thank you, Dr. Duncan, for being with us again on this Q&A section with Dr. Duncan. Now, to get your question answered, remember, you've got to call me. I got to have those questions. So feel free to call me at 248-398-1650. Or go on to the website. I know everybody's online. We're at www.chiropracticworksforyou.com. All right? So go ahead and call us, email us, send us your questions, and you might have yours answered right here on Q&A with Dr. Duncan. Thank you.